Hi, I'm Dr. Jaeniely, a general practitioner in Aster Clinics, Satwa branch. I'm here to talk about influenza. So what is influenza? Influenza is a virus that attacks our respiratory system. There's three kinds of influenza virus that can infect humans. Type A, B, and C. C is a milder form, A and B are the more common ones, and A is the one that we are more wary about because influenza A is the type of virus that could possibly start another pandemic. So how do we get it? We get the influenza by getting in contact with the respiratory droplets of those people who are infected by the virus. The symptoms that we could expect are the symptoms of respiratory origin, so runny nose or stuffed nose, sore throat, coughing, and also fever, body pain, malaise, weakness, and sometimes also nausea and vomiting. When are we infective, or when can we actually pass the virus to other people? It's usually a day before the onset of our symptoms and up to 48 hours to 4 days after the onset of our symptoms. So usually with the viral infections, treatment are mostly symptomatic, meaning we treat the symptoms that the patients are having. But if you test positive for influenza, we could actually give you an antiviral medicine that could shorten the period of your duration and the period of your infectivity, and also to prevent the severe complications of influenza, because even though it's just a common flu, there are still people who die from severe complications like pneumonia or respiratory failure from influenza yearly. So what do we do when we get the influenza virus? So like any other viral infection, treatment is mostly symptomatic, meaning whatever the symptoms the patient is having, that's what we treat. But if you test positive, then we can give you an antiviral medicine which could shorten the duration of your symptoms and also the duration of your infectivity. Also, the antiviral drug is being given to prevent the severe complications that the influenza virus can manifest in a patient, because even if it's just a common flu, yearly many people still die because of the severe complications that the influenza can cause. So what's the best thing to do to prevent? The flu vaccine is given annually because yearly there are new strains of the influenza virus. So your immunity from the previous year may not give you enough immunity this year. So always get your flu vaccine from your doctor yearly.